back. In today's video, we are going to discuss about mental health. It is a chapter of the preventive and social medicine. Before understanding mental health, let us understand the definition of health given by World Health Organization. Health is defined as a state of complete physical, mental, social well-being. It is not just an absence of disease or infirmity in an individual. So we see that to consider a person healthy, he should have physical, mental, and social well being. All these three aspects he should be healthy to consider himself as a healthy individual: physical, mental, and social well being. In this chapter, we are going to focus mainly on mental health. We see that mental health is thus the balanced development of individuals' personality and the emotional attitudes. So we see that it is a balance. It is a balanced development of the individual's personality and his emotional attitudes, which is enabling that individual to live harmoniously with the fellow beings. With his fellow beings, there is a harmony between the fellow beings. What is the definition of that mental health? By definition, mental health is a state of well-being in which the person is realizing his or her individual abilities. They can cope up with the normal stress of life. They can work productively, and they are able to make a contribution to the community. So we see that if a person is having a sound mental health, now let us see, this person is having a sound mental health. If there is a sound mental health, he will know his or her ability. The abilities will be known. Any stress coming up in the life, they can cope up well with it. Also, they work productively. They are able to take care of themselves, also the people who are dependent on them. And also, they make a contribution to the community. They are not a dependent, a burden to the community. Instead, if a person is mentally healthy, he will know his ability, he will cope up with the stress, he will work productively, he will be involved, he will be employed, he will work productively and contribute towards the community. So we are very well aware of the definition of mental health. Now let us understand what are the characteristics of a mentally healthy person. So with this, let us assess ourselves how mentally healthy we are. What are the characteristics? Mental health means not just an absence of mental illness. A mentally healthy person has three main characteristics which are given below. Let us start. What are those characteristics? In the first characteristic, the person feels comfortable about himself. So we see that the person feels himself secure, adequate, and comfortable. So he accepts himself. He accepts his shortcomings. Also, by accepting the shortcomings, by humbling himself, he also carries certain self-respect of himself. He's not always, considering himself a very inferior, considering himself low compared to the others. He will have his own self-respect and self-esteem. He is secure about himself. He considers himself to be adequate and comfortable. Next, the mentally healthy person will feel right towards others. He will love them. If there is a mental illness, there might be a lot of suspicion. Further we are going to study a lot of mental disorders, paranoid disorders and so on, wherein the person will be very suspicious about others, can never think good of others. If a person considers himself secure, adequate, he will not have that over suspicion and jealousy on others. In fact, he will feel right towards others. He will love them. He has friendships that are satisfying and lasting. When we see, we inquire people of the old ages, they have friendships lasting for 40 years, friendship, 50 years old friendship. They are having a satisfying and a long lasting friendships. They trust others. They take the responsibility for his neighbors and also his fellow men. We see that a mentally healthy person will, in fact, on the whole, he will socialize, he will love those around him, and will have healthy relationships with his friendships, fellow beings, a healthy mention. Healthy relationships will be seen in them. Moving on. The mentally healthy person is able to meet the demands of life. We saw that a mentally healthy person will be having a productive life. Having a productive life, having a good employment, he will meet the demands of life. Any stress comes, he will cope it up very beautifully. He does something about the problems as they arise. He finds solutions to those problems. If he is a mentally ill health, if he is into depression, if he is into all completely lost about himself, he is not interested, neither him himself, nor about the problems which are coming up in the house or whatever. He is not bothered about his family. He just lives in a state of depression or not at all concerned about anybody. It could be the other way around. He could be a drug addict and having high imaginative powers, and he could be living in his own dream world. So if you are mentally healthy, you will consider the problems which are coming up, try to look for the solutions, and then he is able to think for himself, and also he can take his own decisions. Now, if I have to pursue doing MD or not, if I want to become a teacher or not, he is able to take his own decisions. He also thinks for himself, is this good for me? In fact, I can think of, if I am mentally ill health, I will consider myself very low. I will not even think about studying in the first place. He gets reasonable, he sets the reasonable goals for himself, and he shoulders his daily responsibilities. He is not bowled over by his emotions of fear, anger, love, or guilt. Being bowled over by love is also bad. We see that unrequited love leading to lots of diseases, anorexia nervosa. The person goes, he even lands up into death. So we see that we should never be, if a mentally healthy person, he will accept his shortcomings, he will accept the failures in his life, he can control his emotions, fear, anger. Too much rage will it's very bad. The whole house will be completely destroyed because of being overboard by emotions. May it be fear, anger, or love turning into possession, suspicion, and so on. So we see that a mentally healthy person will be able to meet the various demands of his life. He will do something about the problem. He will think for himself and takes decisions. He sets goals for himself, takes his daily responsibilities, and not bowled over. He is not bowled over by fear, anger, love, or guilt. Moving on to the next thing is the warning signs of a poor mental health. For now, we assessed how mentally healthy we are. Now, let us see if any of us is stepping towards the warning signs of the mental health. If we are having a poor mental health, William C. Menninger, a psychologist and also a psychiatrist, he gave up 13 questionnaires, and he said any one score which contains an answer which is definitely an S. A yes to any of these questions considered as a poor mental health. And now let us see if we are scoring, how much we are scoring out of these 13 questionnaires. Now let us try solving these questionnaires, which is going to be very fun, and let us evaluate each one of us, and also try to think of the people who will be scoring these questionnaires, the top marks, and also try to reach out to them and help them. Starting with the first one, are you continually unhappy? Do things doesn't make you happy any longer? anything. The silliest thing can make a poor man happy, the biggest thing can make a rich man unhappy. Similarly, there are certain things which can make us happy. Now, no longer have you developed indifference to all of these. Have you started being unhappy over everything? The things used to make you happy does not make you happy any longer. So let us try to think, are you continually unhappy? If the answer is yes, you get 1 point. Moving on, are you regularly troubled by insomnia? So, is your sleep pattern disturbed? Are you suffering a lot to put yourself to bed? How bad is your sleep schedule disturbed? It shows that mental health is disturbed to that level. Next question. Are you upset if your routine is disturbed? So we see that morning 9 o'clock, I want my mama to give me breakfast. So if my routine, if the one day the breakfast isn't ready or the Ola is not on time, so we see that these little slight things, if the routine is disturbed, how much impact is it causing on us? Are we getting in a lot of anger, rage? Am I abusing my mother? Am I abusing the Ola driver, being completely in a very bad manners? Am I losing my morals, ethics, and behaving in a very rude way? It shows that I become very upset if the routine is disturbed. In that cases, I score a point. If I am able to cope it up, okay, mama didn't make breakfast, it's fine, I will have something outside, I will manage, not a problem. Behaving in a proper way, it shows that mentally you're healthy, you're able to accept the things, you're able to accept even if your routine is altered, it does not cause a major impact on your mental health. Are you unable to concentrate? Now we saw that, let us try to make up a story out of it. So you were unhappy, you were troubled by insomnia, and then morning you woke up, there was no breakfast, your routine is disturbed. Moving on, you went to the college or the class, your school, you're unable to concentrate. So think about it. If you're continuously not able to concentrate in your class hours or your clinical places and so on, are you unable to concentrate? Children consistently get on to your nerves. The patients, the babies who are coming to your clinic, or the children of your siblings, of your sister's kids, brother's kids, your niece, nephews, are those kids or your own kids getting on your nerves? Are they constantly getting on your nerves? The slightest thing, is it making you completely lose your mind? It shows that your mental health is little poor. So we, not little, it's kind of, even if it is definitely yes, it means that your mental health is poor. So let us see if you're scoring a point. So now let us see what happened. You were unhappy, you did not sleep the previous night, you woke up in the morning, routine was altered, there was some disturbance, you couldn't concentrate. The children who came to your clinic, they got on your nerves, and you lost your temper easily. So do you lose your temper easily? And then, do you speak constantly bitter? So, constantly bitter. Always you think bad about the other person, never thinking in a good aspect. The positive thing is completely gone. Always being a pessimist. You see, you tell people this person is always a pessimist. He never thinks good of anybody. Anybody in his eyes is bad. He tries to take out most of the negative things in a person. When you do that, it's like you are constantly bitter. So you're making bitter aspersions about a person. So that is completely warning you towards your poor mental health. Do you think you are always right? Contradiction excites anger. You cannot bear contradiction. Anybody contradicting your point, saying something opposite to what you're willing or what you're speaking, it causes you a lot of trouble. So you always think you're the one who is always right. Do you dislike to be with people? Do you prefer isolation? Do you dislike being with people? Always prefer to be alone rather than being with people? You dislike socialization? It means your mental health is poor. Are you always worrying? Always there is anxiety. Anxiety could be related to your own health. It could be related to your closed ones, loved ones. There is constant worrying about one or the other thing. Are you always afraid without any cause? There is no cause, but you're always afraid of something. Then you get another point. Do you have ache and pain in the body without any cause? So just starting, I have leg pain, I have back pain, my shoulders are hurting, my head is hurting. What is the cause? There is no external injury, nor that there is any pathological change in the organ. So we see that there are no reason, no external cause or an internal cause. Without any cause you're suffering with the ache and pain. Do you have fluctuations of moods with elation to depression? You see, one moment you're extremely happy, lots of gay, full, joyful, happy, and then the next moment you're all depressed. Just imagine coming back from college, you're all going to the college, you're all happy with your friends, very joyful mood, and then you come back home, you're all depressed, sad, weeping. So there is complete alteration of moods, there is fluctuation of the moods. So we see that these are the indicators of the poor mental health. So by this we complete two topics. Now we are moving on to the third topic, that is types of mental health. In the types of mental health, mental and behavioral disorders are clinically significant conditions. So we see that before understanding the type, we need to know what is mental disorder. So the mental or behavioral disorder, what are those? They are clinically significant condition. It is a clinical condition wherein it is characterized by, first thing, there is alteration in the thinking, there is alteration in the mood, then or the behavior associated with personal distress or impaired function. We see that there is alteration even in the behavior. Now let us see what are the types of mental illness. Mental illness. The International Classification of Diseases, that is ICD-10. So we are studying about International Classification of the Diseases. We see that first one is organic. Organic is including the symptomatic mental disorders, that is dementia and Alzheimer's disease and delirium. So the Alzheimer's disease is nothing but a degenerative brain disorder of an unknown etiology. It is a most common form of dementia. So we see that Alzheimer's disease, there is a pathological change. It is a symptomatic disease. It is a mental disorder wherein dementia will be seen. What happens in this is there will be progressive memory loss, there will be disorientation, the thinking of the person will be altered, his personality, mood changes will be there. Basically, it is a pathological condition, degenerative condition of the brain, where the neurofibrillary tangles. So we see that here dying neurons with tangles. Plaque formation will be there. The plaques will be formed. You can see a healthy neuron and compared to the degenerated neuron, dying neuron with tangles and plaque. So we see here the organic, wherein you can find out the pathological change there, that is Alzheimer's disease. It is most commonly seen in the old ages. Moving on to the second classification, we have mental and behavioral disorders, which is due to the psychoactive substances. So there is use of psychoactive substances which is resulting to this behavioral and mental disorder. That is, the psychoactive substances could be the stimulants like alcohol, opioid dependence syndrome. So we have two things under that. The first one is opioids, and the second one is alcohol and opioid dependence syndrome. So opioid use disorder, it will consist of overpowering desire to use opioids. So we see that opioid dependence. What do you mean by opioid dependence? Initially you were taking one injection. Later on, one injection you started developing the tolerance to one injection. Later on you started using 2, 3. So now the dependency on this opioid started developing in your body. You started, the opioid tolerance became increased in your body, so you're able to take 4 injections now, yet it is not producing any effect. Now you started depending more and more and more on the opioids. In case you withdraw from it, the withdrawal symptoms will start when you discontinue taking opioids. That is nothing but the opioid dependence syndrome. Schizophrenia, schizoptol, and delusional disorders. So we are moving on to the third type of mental disorder, that is schizophrenia, and we have schizoptol disorder. So let us see what is schizoptol disorder. Schizoptol disorder, wherein the person will have odd behavior. His thinking, speech will be very odd. There is suspicion, paranoid is seen in them, suspicion to an extreme degree. They have a difficulty in making and keeping the friends. They have anxiety, mood disturbances are seen. So basically what happens in schizoptol, there is mood, schizoptol, what's happening, there is mood disturbances, they cannot make friends, they have difficulty in keeping friends, suspicion is increased to a greater degree, and the behavior and their speech is very odd. Now moving on to the next thing, that is we have paranoid schizophrenia. So we know in paranoid schizophrenia what happens, the person will have what is schizophrenia in the first place? Schizophrenia is nothing but disruption in the thoughts. Their thoughts will be completely disrupted, emotions are disrupted, behavior is disrupted. The mental disorder which is characterized by disruption in the thoughts, emotions, and their behavior is nothing but schizophrenia. Now here they are speaking about paranoid schizophrenia, wherein the person is having an extreme suspicion towards others. Then we have delusional disorder. What is a delusional disorder? Delusional disorder is nothing but a person cannot tell what's real from what is being imagined here. He is delusional. He does not know what is real and what he is imagining. He cannot make a clear difference between the two. Acute and transient psychotic disorder. So we are speaking about acute and transient psychotic disorder, wherein there will be hallucinations, delusions, and incoherent speech. Their speech cannot be understood. They speak kuch bhi, incoherent speech. Okay. So now we saw that there is acute and transient psychotic disorders, delusion disorders, and paranoid schizophrenia. So these are the three things which come under the delusional disorders and schizoptol and schizophrenia. Moving on, we have mood or mood affective disorders. In mood affective disorders, we have bipolar affective disorder and depressive episode. Bipolar disorder. Bipolar. So we see bi is used when there are two things. Bipolar, two poles, okay, north pole, south pole. So they are completely different opposite poles. Bipolar, two different states of mental expressions. So there will be mania in the first place and depression alternatingly. In the first mood, the person will be talking excessively, he will be loquacious, he have continuous racing thoughts, there is hostility, the sleep is disturbed, he cannot sleep, and there will be delusions. Whereas in the other state, when there is depression, depressive state, he will be extremely fatigued, there is sadness. Here he was talking excessively and happy. Here there is sadness, memory loss, and poor nutrition. They dislike, there will be anorexia, they do not like to take food. So these are the two alternating moods which are seen. Bipolar disorder, extreme alteration in the mood, and also we have depressive episodes. Moving on, neurotic, stress related, and somatoform disorder, in which we have generalized anxiety disorders and obsessive compulsive disorder, which is popularly known as OCDs. So a very common thing, that is anxiety disorder, wherein the person is having excessive anxiety and worry. he is restless, there is irritability, he has difficulty in sleeping because of the anxiety. Also, we have muscle ache and soreness. The sleep is disturbed. Obviously, the fatigue is going to develop in the patient and impaired concentration. Now, let us see about OCDs and also the common examples of OCD. OCD is a condition wherein we have a very frequent unwanted obsessions. Obsession. Now you're having an obsession in studying. It's nothing bad. It's passion. So that's completely normal. When there is an unwanted obsession which is causing you to perform the compulsion, that is known as obsessive compulsive disorder. The symptoms could include the fear of germs or dirt. You constantly keep cleaning all the time, cleaning the floor, cleaning your surfaces, surrounding surface. So the fear of germs and dirt which is leading you to cleaning. Fear of making a mistake. Need for order, neatness, symmetry or perfection. So come always thinking about the perfection. Any the clock in the room is tilted, he will leave about everything, he will go make the clock proper. If the book is not kept properly, he'll arrange the book properly. So everything around should be neat, clean and in order. Fear of causing harm to yourself or someone else. All these obsessive compulsive symptoms. These symptoms can include arranging things in a specific way, repeatedly checking things, bathing or washing your hands over and over. So we saw fear of germs, which could lead you to the bathing or washing, and then number rituals such as counting repeatedly, etc. So all these are examples of obsessive compulsive disorders. I'm giving these examples so that all of these remain in your mind till the end of your practice or so on. So any neurotic or stress related somatoform disorder, it comprises of the anxiety and obsessive compulsive disorders. Moving on, we have behavioral syndromes which are associated with psychological disturbances and physical factors. So we are talking about the behavioral syndromes. So the behavioral syndrome. So we see the behave such long thing what they have written. I'll split it into two and it's very simple. It just looks complicated. When you understand, it's very simple. So we have behavioral disorder. This behavioral disorder, it is causing physiological disturbance. What is physiological? It is causing functional disturbances and some physical factors are developing. Okay. So we see that again when we read it, we'll get it very clearly. So we saw discard, yeah. Behavioral syndromes which are associated with what? Functional disturbances, that is physiological disturbances and physical factors. The examples could be the eating disorders and non-organic sleep disorder. What is this non-organic insomnia? It is nothing but the difficulty of falling asleep or maintaining the sleep. It is a non-refreshing sleep. So that is nothing but non-organic insomnia or sleeping disorder. Moving on, we have disorders of adult personality and behavior, wherein we have paranoid personality disorder and transsexualism. So we have paranoid personality disorder wherein there is suspicion of others' behavior and mistrust. So you're walking in the street, anybody walking just behind you, you start believing that this guy is chasing me, he's gonna kill me, he's going to murder me, I'm gonna be kidnapped, is all you think. That is mistrust and suspicion over others' behavior. If this develops, now let us take an example, Indian traditional example. So now the daughter-in-law is cooking, and now if the mother-in-law is having this paranoid personality disorder, she's very suspicious. She feels that this sister that the daughter-in-law is going to put poison in my food and she wants to kill me. She's just doing something else, and always she's suspicious about her, and this is nothing but always being suspicious about others' intentions towards you is paranoid personality disorder, the mistrust you have in them. And transsexualism is the constant desire to change the anatomical gender of that person. For example, now I am a female, I'm a woman, and now I have the constant desire to change the anatomical organ into a male sexual organ. That is nothing but the we know transgenders is nothing but the transsexualism, which comes under the disorders of adult personality. Okay. Next, we move on to the other thing, that is mental retardation. So we saw Down syndrome. We have so many other things which are coming up where there is mental retardation in the children. Next, we have disorders of psychological development. So there are disorders of psychological development. They are specific reading disorders and childhood autism. Childhood autism, you can see the kid here. Childhood autism is wherein the person does not want to make eye contact with anybody. He does not like to socialize with those around him. He dislikes socializing, likes to be all alone. The speech, the communication, there is problem. Autism, we have various autisms for now. Childhood autism. Then moving on, we have behavioral and emotional disorders with the onset usually occurring in childhood and adolescence. So we have certain behavioral and emotional disorders, but their onset is usually seen during the childhood and adolescence. We have hyperkinetic disorders. Hyperkinetic, wherein there is a sudden continuous movements. Okay. And then we have conduct disorders, wherein the child is having complete disregard to others. They lack sympathy to a certain extent. We can also think they lack the basic empathy or sympathy towards others. Complete disregard to others, it is conduct disorder. And we have tic disorder. Tic disorder, you can see here the tic disorder where there will be sudden twitching movements. For example, this kid is having a motor tic where there is continuous blinking of the eyes. So this is hyperkinetic disorder and this is tic disorder. So we have completed the international classification of the diseases where we saw organic, mental behavioral disorder, schizophrenia, mood disorders, neurotic disorders, behavioral disorders, disorders of adult personality, psychological development, and behavioral and emotional disorder. We also have some unspecific mental disorders. Now we are moving on to the next part, that is types of mental illness. The mental illnesses is a very vast subject. They have broad in its limits and it is difficult to define it very precisely. Therefore, they divided the mental disorders into major and minor criteria. The major illness are called psychosis. So we see that the major illness are psychosis. Here the person is insane, he is out of touch with the reality. So we have three major mental illnesses. What are those three major mental illnesses? In the first mental illness, we have schizophrenia, where it is split personality. So we also have some movies on split personalities, in which the patient lives in a dream world of his own. There is a split personality. This person has no regard to his surrounding, to the people, to himself. He lives in his own dream world. Next, we have maniac depressive psychosis. Maniac depressive psychosis, the symptoms will vary from heights of excitement to the depths of depression. Next, we have paranoia, wherein I have told you multiple times, there is extreme and undue suspicion and a progressive tendency to regard the whole world as a framework of delusions. So we see that there is extreme suspicion in the first place, and also they have a tendency that the whole world is a framework of delusion to them. So we see that here these three are the major mental illnesses, that is schizophrenia, maniac depressive psychosis, and paranoia. Next, we have the minor illnesses which are again divided into two groups. The minor illness, we have the two groups, that is neurosis and psychoneurosis, personality and character disorder. Starting with neurosis and psychoneurosis. In this, the patient is unable to react normally to the life situations. He is not considered insane by his associates, but nevertheless, he exhibits certain peculiar symptoms like morbid fears, compulsions, obsessions. So, this person, he just is not acting normally to the situation. He is not completely insane. You do not send him to the to take the health service. You don't send him to the asylum or something. In fact, they are considered to be sane by the society. You never tell them that this is an insane person. But what is the problem here? He is not able to react normally. He exhibits the peculiar symptoms like fears, compulsions, obsessions. We have the next minor, that is the reason we consider it to be a minor mental illness. Then we have personality and character disorder. This group of disorders are the legacy of unfortunate childhood experiences and perceptions. We know that the personality and character disorders, there are many. We see that children, juvenile delinquencies, and so on. Now, when we study the causes of mental health, we see that because of the unfortunate childhood experiences, that is because of the broken homes, unhappy marriages, the improper family structure, and also the rejections, cruelty, what they go through, that insecurities of them will, these experiences and perceptions will develop the personality and character disorders in the people. So I guess the major mental illness: schizophrenia, maniac, depressive psychosis, and paranoia. Minor, we have neurosis and psychoneurosis, personality and character disorder. Moving on to the causes of mental health. The causes of mental health are again classified into organic causes, hereditary, socio-pathological causes, wherein we have environmental factors, and environmental factors again further includes many classifications, which will be dealing in the upcoming slides. For now, let us focus on the organic conditions. Organic conditions: mental illness have their origin in organic conditions. One of the organic condition, that is silent epidemic, is Alzheimer's disease. So we saw that the Alzheimer's disease, wherein the neuron, it was a degenerative condition where the neuron developed tangles and plaques. So here we see that there are origin, that is organic origin of mental illnesses. There could be the cerebral arteriosclerosis, okay, cerebral arteriosclerosis, neoplasms, so the cancers, neoplasms, and we have metabolic diseases, neurological diseases, nerve involvement, endocrine, hormonal involvement, endocrine diseases, chronic diseases like TB, leprosy, and epilepsy, where in the late stages the person will be affected mentally. Moving on to hereditary, which is an important factor in some cases. Example: the child of the two schizophrenic parents is 40 times more likely to develop schizophrenia. So this is very upsetting. The schizophrenic patients, if the mother is suffering from schizophrenia and the father is suffering from schizophrenia, then the child is likely to develop schizophrenia by 40%. Moving on to the next cause, we have sociopathological causes. In the sociopathological causes, to produce any disease, there must be a combination of genetic as well as environmental factors. These environmental, social factors play a very major role in the development of mental illness. So we see that the social and environmental factors which are associated with mental ill health will comprise the worry, anxiety, the emotional stress, tension, frustration, the unhappy marriages, the broken homes, poverty, industrialization, urbanization, changing family structures, Population mobility, so the single child, it is wherein the child has no siblings and he cannot express anything, lots of suppression and many things they go through in life. So we have family structures changing, or it could also be the population mobility, economic insecurities. Their basic social needs are not met, not just the social needs, I'm sorry, their basic needs which are very necessary to carry on their day to day activities in life are not met because of the poverty, because of a lot of populated country, like in India and China, wherein the poverty still prevails in the rural areas and even in the urban cities, wherein the basic needs of people are not met, they are starving. Even there, that creates a lot of anxiety, the worry. Even the childhood, there is a very crucial point in the life cycle of the child, the pregnancy. You think during pregnancy, if the mother is having a very stressful period, the child is likely to develop mental illnesses. Even during the first 5 years of life, that is the early childhood, if the child couldn't experience a warm, intimate and a continuous relationship with his mother and father, because of these broken homes and unhappy marriages, the child is not nurtured properly. These broken homes are likely to produce the behavioral disorders in the children. Everything that happens in the school will also affect the children. And the cruelty, the rejection, you can think of adolescence, wherein which is a very stormy period in a person's life, where it's very dangerous to the mental health, wherein the youth and the people who suffer with rejections could be the socially, it could be the love failures, and in the society their position couldn't be maintained, they failed getting a job, they couldn't compete with their siblings or their associated peers. So that can also lead to serious mental illnesses. Also, we see juvenile delinquencies, that is the children becoming started performing criminal activities, becoming drug addicts and so on. So these socio-pathological causes, the neglect and the like, can cause the mental ill health. Now we are moving on to the next topic, next point, that is environmental factors. These environmental factors, they are capable of producing the abnormal human behavior. Those factors will include the toxic substances. Toxic substances are carbon disulfide, mercury, manganese, tin and lead compounds. We have psychotropic drugs like alcohol. So we saw the psychoactive substances, psychotropic substances like alcohol, barbiturates, opioids. We also have griseofulvin. Then we have nutritional factors like the deficiency of thiamine and pyridoxine in the body, vitamin B3, vitamin and so on. So those vitamins can also cause, these deficiencies can also result in mental illnesses. Then we have mineral deficiencies like iodine. Moving on, we have infectious diseases. Infectious diseases like measles, rubella, which is having a very adverse effect on the child's brain development. During pregnancy, during the prenatal period or perinatal or postnatal periods of the life, they will have a very adverse effect on the brain development, and also their mental functions. The integration of the mental functions will be altered if the mother during pregnancy suffered with the viral infections and also the infectious diseases like rubella, measles. We have traumatic factors, that is road and occupational accidents, and the radiations, that is nervous system, which is mostly sensitive to radiation during the period of neural development. So it is, the nervous system is very much sensitive to radiation during that neural development which is happening in the child. If the mother is exposed to the radiations, harmful radiations, they can result in mental retardation in the kids. Thank you. With this, we come to an end of the main topics of mental health. A very important topic, that is alcoholism and drug dependence, mental health services and the mental health program, will be dealt in the part 2 of this video. For now, we come to an end. I hope you like the video, and if you like the video, hit the like button and please subscribe. Thank you.